Hello, I'm Jerry Shapiro. I'm a professor of dermatology at New York University. I am director of the disorders of hair and scalp, and I'm one of the few dermatologists in the world who just devotes his entire practice to hair only. That's all I do. So all I see is hair loss day in and day out. And I've been doing this for almost 40 years. Well, I think it's very pivotal. It's because we see something that works quickly. Nothing we have now works that fast. It's 2 months. There is nothing available that I can give a female who has androgenetic alopecia that will work within 2 months. This is quite phenomenal. Plus the density and the width of the hairs, they've gone up as well. And so we see it very quickly. So not only is it rapidity, but also density is also extremely good as well. So it is something that is a game changer as far as I'm concerned. This data really makes a difference. The data, at least what we have from the phase 2 study, is quite phenomenal. It shows rapidity of the response, and the efficacy is so great. So there are other things that can be used. There are oral medications such as spironolactone, finasteride, bicalutamide, but some of these have hormonal effects, and this drug minoxidil doesn't have any hormonal effects. So we're very happy that we're not going to have irregular periods. We're not, or where periods can even stop in women when they're on spironolactone. And so you have the uterine lining getting just building up. So we have to be very careful with some of these other medications. And, we need the seal of approval, which we can get once we get this approved. If we have this drug approved, then we feel more confident that we're giving something safe to a female. We have to be very careful what we give them. They have all sorts of side effects. Spironolactone can cause increased potassium levels, low sodium levels. This drug hardly has any side effects. And we're always, of course, worried about cardiotoxicity with immediate release. And this does not have any of that because it's slow release. So we're not really worried about any big side effect profile with this. Well, extended release allows the drug to have a certain level in the blood that's prolonged. Minoxidil itself does not work by minoxidil alone. It needs to be sulfated, and by having it sulfated, it works better and is more efficacious. If it's in the blood longer and it's there for a prolonged period of time, then there's more chance that much of the drug will be sulfated. So that's what makes it so great, in that you have this period of sulfation that can go on and on throughout the day, while the immediate release, within 2 to 4 hours, it's gone. So we want something that stays in the blood longer.